It's called Graves' disease, a condition affecting 8 times as many women as men. Now, while treatments continue to improve and progress combating this autoimmune thyroid disorder is being made, Graves remains a difficult to diagnose disease. With us to shed light and insight on this important medical topic is Dr. Mark Lupo, Medical Director at the Thyroid and Endocrine Center of Florida. And coming up a little bit later, we're going to meet a mother whose 14-year-old daughter's early signs of Graves remained a mystery until an accurate diagnosis was revealed. Good morning, doctor.
Good morning, Olga. Nice to be here.
Thank you for being here. Let's talk first about Graves' disease. What is it exactly?
So Graves' disease is the most common cause of an overactive thyroid. So before we get into the Graves' disease, we have to remember the thyroid is a butterfly-shaped gland that sits at the base of the neck and creates thyroid hormone, which controls metabolism and energy for all parts of the body. So if your thyroid's not working, you're not working. In the case of Graves' disease, which is the most common cause of hyper or overactive thyroid, the thyroid is making too much thyroid hormone, so everything is sped up. And Graves' disease is often concerning as a name because they think it's a grave prognosis.
And when I first heard it, I thought to myself, wow, you know, a disease that's grave, but that's not necessarily
the case.
truth.
It was named after Sir Robert Graves from 200 years ago, who discovered the disease. So the prognosis, luckily, with proper identification of the disease and treatment, is quite good.
Help me understand why it affects such a disproportionate number of women.
Women seem to be more prone to Graves' disease, about 8 to 10 times more so than men. We don't know exactly why, but it has something to do with sex hormone, estrogen, progesterone. And if we look at women who have had pregnancy within 12 months, 30% of people who are diagnosed with Graves' disease have had pregnancy within the last 12 months. So there's something about pregnancy, the sex hormones, that might stimulate the risk of Graves' disease.
Now, are there specific signs and symptoms that people can look for?
Absolutely. So the signs of Graves' disease are the physical signs. So people have prominent eyes, and that happens in about 40 to 50% of patients.
And speaking of that, we have some images I'd like to share with our viewers. Tell me what we're seeing here. Are these some of the signs here?
Yes, this is not a subtle thyroid eye disease. This is more end stage, where patients have a significant amount of swelling behind the eyeball. So the eyeball gets pushed out in front. So that's called proptosis.
Okay.
And then sometimes the same thing can happen with swelling of the skin. So they can get swelling and redness of the skin in front of the shin, and also some changes in the hands as well. That's not as common, though. It can also cause an increased heart rate or tachycardia, so patients feel an increased awareness of their heart, like it's beating out of their chest sometimes, and that can be quite uncomfortable, and one of the first things that causes the patient to go to the doctor for help. Anxiety, short fuse, a lot of mood changes and irritability, insomnia, weight loss, feeling very hot, muscle weakness, where if you're climbing a flight of steps, you feel weaker, exercise intolerance, shortness of breath, things like that.
Now, you mentioned pregnancy. Is there a certain age group that maybe can happen more in, or is that not a factor?
So the pregnancy issue reminds us it's more of a reproductive age woman. So usually women in their 20s and 30s are more prone, but there's not an age cutoff. So this could happen any age, both for men and women, but typically in the 20s and 30s most commonly.
And doctor, are there effective ways to treat this disease?
Absolutely. So we have ways to control the excessive amount of thyroid hormone production.
Okay.
And there's 3 primary ways to treat it. So one is with medications that block the thyroid's ability to make extra thyroid hormone, and that's called medication management. And then the other treatments we call definitive therapy. So definitive means we're doing an irreversible procedure to completely knock the thyroid out. So that's either radiation treatment in the form of radioactive iodine, which is a pill, or surgery to take the whole thyroid out.
I love hearing that there are options. I want you to stay right there, because when we come back, we're going to meet a mother whose 14-year-old daughter was diagnosed with Graves' disease. Her personal story when we come back. Stay tuned. Welcome back, everyone. We're talking about Graves' disease. Once again, we're joined by Dr. Mark Lupo, Medical Director at the Thyroid and Endocrine Center of Florida. And joining me now is Dr. Nicole McDonald, a family physician with the New Boston Village Primary Care located in Fall River, Massachusetts. Welcome.
Thank you.
Thanks for being here. Now, doctor, I know you have a personal story. Your 14-year-old daughter has Graves' disease. Tell me how you found out and what happened.
It started around 6 years old. She started becoming very anxious and irritable, flew off the handle over the smallest of things. Then we noticed her appetite became voracious. She'd be eating 3 breakfasts a day, eating, dinner, lunch, just constantly eating without gaining any weight. Wow. Then we live in New England where it's obviously very cold. In the winter, she'd be going outside without a jacket on, running around in her underwear, never feeling the cold.
Okay, so you obviously know something's not right.
Yeah, I said something's not right here. Then I noticed she had a fine tremor and her handwriting was becoming very sloppy. My husband has a tremor, so I figured it was something familial. Finally, one day we were sitting in the kitchen across from each other and she happened to look up, and that's when I noticed she had a goiter, which is an enlarged thyroid, and it all clicked together. So I called her pediatrician. I said, something's not right here with her thyroid. And he goes, oh, kids don't usually get that, but let's just check some blood work. We did the blood work and her thyroid was out of control. At that point, I felt her heart, and her poor little heart was beating out of control.
So she had that tachycardia.
She had the tachycardia.
When you got the diagnosis, I know you're a physician, but were you petrified?
Oh, I was terrified. It's your baby and you don't know what's going on. And as a physician, I didn't know a whole lot about Graves' disease.
You didn't?
No, and wasn't much out there, especially for children with Graves' disease, since it's very rare.
So what happens when it's left undiagnosed? Because we saw images. Is that the scenario?
Some of the images we saw were the extreme scenario of the eye disease that gets really bad and can threaten vision sometimes. People can go blind potentially. The heart can beat so fast that you have high output heart failure, where you go into heart failure, and also you have abnormal heart rhythm problems, particularly atrial fibrillation, which can cause a stroke. So this is a deadly disease left untreated.
So early diagnosis is so key, isn't it,
Absolutely,
doctor?
absolutely.
What treatment is your daughter undergoing right now, and how has she improved?
So she started on medicine to try to suppress the immune system, but with kids, they rarely go into remission. So then we had to decide between the radioactive iodine or the surgery. She wasn't a candidate for the radioactive iodine, so she actually had to have 6.5-hour surgery to have her whole thyroid removed.
My goodness. And doctor?
As we talked about before, we have medication management, but in some cases, especially with kids, the disease is relatively aggressive. And so the medications don't drive things into remission and don't work as well, and there's potential side effects. So going to surgery or radioactive iodine, and for children, our experience with radioactive iodine is more limited, which is why I think in this case they chose surgery. And it's a very difficult surgery at age 8 to do, and you have to have a very experienced surgeon. So for adults, the surgery might last 1, 2, or even up to 6 hours, but the key is, if surgery is chosen, to work with a surgeon that does a lot of thyroid surgery.
I want to end with you. Anything you would tell our viewers out there who maybe don't know about Graves' disease, or maybe they're hearing about a diagnosis today?
Yes, there's an organization that I found that was invaluable. It's the Graves' Disease and Thyroid Foundation, and it's gravesdiseaseandthyroidfoundation.org. As a physician, I didn't have as much knowledge as I should, and the foundation was a world of wealth. So I would definitely encourage anyone to look into that.
Thank you so much.
Thank you so much.
God bless you, and good luck to your daughter, and God bless her. Doctor, thank you so much.
Thank you. Appreciate that.
Really appreciate your time. And if you'd like more information on conditions affecting the thyroid, you can also visit us at thebalancingact.com. We have all the information there for you. Or join in on the discussion by logging on to Facebook /The Balancing Act Fans.